The Lifestyle Show, presented by
Giles Brown.
Heart Matters with Dr. Pedro Aranda.
Oh, I do like a new piece of music on the show. We have a new feature, and we have a new guest, a new contributor. I'm delighted to welcome onto the show for the very first time, Dr. Pedro Aranda. Dr. Pedro Aranda. How should we address you today?
Well, Aranda, Pedro is fine. So, however you are more comfortable.
Wonderful.
Thank you very much for this kind invitation.
No, the pleasure's all mine. Because you are a specialist, and heart disease is one of the leading factors and one of the leading health concerns worldwide. Many people, though, are sort of ignoring the signs, the warning signs. So you're a cardiac surgeon. Whereabouts are you a cardiac surgeon, and how long have you been in this field of medicine?
Well, it's been 25 years already, and we started actually in Vitas Sanit in Benalmádena 20 years ago, doing open heart surgery. We recently had a celebration about it, and we are building a great team with a lot of people and a lot of surgeons from the world that are coming with us also.
One of the things is the fact that in any other business or any other profession, 25 years, if you're an abogado, a lawyer, or if you're a notario, nothing has changed in 25 years. Okay, you may have a few bits of modern technology, but I mean, in your business, in your vocation, in your profession, it has changed. It changes. It used to change in 10 years. It used to change in 5 years. Now it's changing every 2 years. Now,
every minute.
Yeah.
Yeah, absolutely. It's been, we still do a lot of interventions that we were doing 50 years ago, like coronary bypass.
Yeah.
That it hasn't changed so much, really, even though we have, of course, stenting, for example. But then also in the treatment of heart valves, and all things are changing very rapidly towards a less invasive and a safer surgery. We are, especially now, it's growing exponentially, all the transcatheter treatments that now we can do from the groin instead of opening the chest open, wide open, and making a much faster recovery. But all these changes need to be looked not everything new is necessarily better. So we need to use each technology for each patient, because some major operations that can be big operations that can be like more aggressive are actually more long lasting.
Yeah.
So we need to make sure, depending on how fit you are, what kind of disease you have, some of the new technologies are more proven, and others are so new that we don't know what's going to happen in 10 years or 5 years.
And the other thing, I mean, with your in your profession in heart surgery, you must spend. You do practical. Obviously, you're doing the surgeries you're doing, but to read, to research, to keep. It's almost like you never finish medical college because you are always learning something. Which is a great thing, but still, it must be. I could have been a notario. I could have been sitting there with my desk doing that. Sometimes you must. It must be fascinating, but also it's hard work.
Overwhelming.
Yeah.
Sometimes. Yeah. We need to study all the time. We attend meetings and all that. We also hold meetings in Sanit, bring professionals from all over the place. But the things have gotten so specialized that in our team, for example, we have probably one of the best guys for aortic surgery in the world. He's coming from the Netherlands, and he comes when we have a very complex case to do the case. Or we have a Dr. Robin Hickman, or we are starting a minimally invasive program, and you cannot master every technique. So what we play with here is that we can bring people from all over Europe mainly that are very, very specific in their field. And so when we have a specific patient that would really benefit from a special kind of technique, we bring the best guy to do it. So it's not like me trying to do all the best, everything. We try to do the best for each patient, and if we have the resources, we bring whoever does it best.
It makes perfect sense. I mean, this is a silly comparison, but if you have a big football team and you have one role, then you bring in a specialized player so that you win the game, as it were. I want to ask because with the internet, and we are becoming more as a society, we are becoming more aware of our health. We have a wealth of knowledge at the end on our mobile phones. We can just plug in.
Absolutely.
We know we are surrounded here in Spain. We are blessed by great food, great fresh vegetables, fish, etc., etc. And the other side is we are blessed with wonderful climates to enjoy, to exercise. But we know all this. But on the other side, we are seeing more obesity, more heart problems, worse diets. It must, to a certain extent, this must drive you a little bit crazy, Pedro.
Well, it's very difficult for doctors also to stick to a diet.
Yeah, of course.
Stick to an exercise program. We are human, and we try our best. We know what to do. We know we need to have more veggies. We need to have more fruit, more fish.
Yeah.
We need to not smoke, not drink, or drink as little as possible. And if, in case we drink, use mainly red wine or fermented things. And we all know what to do, but we really need to be more focused on trying to take care of our health, because our body is the one that's going to last us forever, and the heart is all the same. Heart disease develops over decades.
Yeah,
it's not so. It's not only something that you do now, or it's been over decades building up, like a plaque of calcium
on the teeth,
blocking a coronary.
Yeah.
It goes so slow, like from the diet, even when you're a teenager.
So if it goes so slow, and then suddenly it's like attack.
Yeah.
So, but are there signs that maybe you would recognize, but as a member of the public, are there symptoms? Are there signs that I may have, and you might think, right, we need to talk. What are the signs that people miss, Pedro?
Yeah, they say that your heart speaks to you, and basically there are 4 symptoms.
Right.
The heart. One is pain, the one that's most common that people, but it's not like a sharp pain, it's a pressure.
Okay.
It's like you feel a compression in your chest, and that kind of pain can be worrisome, and that's the kind of pain we need to look for.
So a pressure, not like a heartburn, and when you've had
or like a pinpoint thing. It's normally more like a pressure thing.
Okay.
The other symptom is when you feel like very short of breath, and you start to feel like you are going up the stairs, and you fall short of breath very easily, and basically like you are doing things that you used to do before and you cannot do them anymore, and like in the 6 months before, and now it's changed. So that kind of symptom, it may be an indication of heart failure.
Right.
For example, the muscle is not working as well as it should, and you need to seek some advice. The other one is palpitations. We all feel that every now and then, like you feel a heartbeat that skips, or that it goes suddenly like very fast.
Yeah. Normally at 3 in the morning, on in bed, you wake up and you think, oh, this is it.
And you're like, what? Yeah, absolutely. So that is saying that there might be an issue with your electric system of the heart.
Yeah.
So that also needs to be looked at. And a third one, which is more dramatic, is what we call syncope, which is fainting.
Yeah.
Sometimes fainting because the heart has a blockage and it goes very slow, or you have an aortic stenosis, what we call a blockage of one of the valves, or things like that. So those 4 symptoms are the ones that we need to to say, hey, maybe there's something, and we need to have it checked. And now it's quite simple to get it checked because we can actually do a ECG, which is very easy, or then you can also have an echo. We also have MRI, we have CT scans. We have plenty of technology to know exactly what's going on. So, yeah.
I mean, if you have any of these, I mean, obviously one of the best things to do is to have your personal ITUV, your own MOT every year.
Absolutely.
So that you can, because just for your own peace of mind, especially, and men are the worst at this. I mean, we're just the worst. We don't get our ITUVs.
We just push it until we
don't. Exactly, basically. It's a manly thing to do. And that's why men pass away, because for women are very aware of their health because of their bodies and all the changes they go through. Men just think, okay, well, I'll go to the bar and I'll think about it next week. Which is the thing, which is, and you could, so, I mean, a regular checkup for anything has got to be good, especially as we get more mature, Pedro.
Yeah, there is a time, even after 40, but mainly after 50, 60, when we really need to be more aware. And lifelong, the most important is that we know most cardiovascular risk factors.
Right.
And those are hypertension, smoking, high cholesterol, and diabetes.
Yeah.
So, or high blood sugar and obesity as well. So all those that sometimes they come together as called the metabolic syndrome, those need to be addressed lifelong. And then the thing with treating hypertension, for example, is that you are not aware that you are winning.
It's hypertension. Just explain. Is hypertension stress, or is it something completely different?
Hypertension means that the pressure inside your blood vessels is very high.
Right.
And normally we measure it in millimeters of mercury. It should be below 120/80. That's a figure.
Right, the blood pressure, yeah.
We should aim to be below that. If we go above, then we need to take care of our diet, normally losing weight and having less salt and pre-manufactured foods and things like that. And especially exercise. That will help to reduce it, but very often we need medication.
I mean, exercise is there are very few excuses. I live in Coín, on the edge of Coín, and every morning when I drive out in the morning, the sun is coming up, and you will see the vecinos, you'll see the ancianos here having their walk. And Spain is great because they've put in all these paths. You couldn't do the same in the UK. I mean, all these paths and those machines that they. Yeah, I mean, the funniest thing you will see is some abuela doing the walking machine or like that with an helado, with an ice cream in her hand. I'm like, yeah, okay. But exercise is great because again, it will help you not only physically but also mentally, psychologically.
Yeah, absolutely. Exercise is probably the best pill we can have. The only thing is it needs discipline and it needs to be stuck to it. And now we are seeing that it's not only aerobic exercise, which is like walking or running or jogging, that used to be like the more healthy way of exercising. It is also actually strength training. Building muscle has proven to reduce high blood pressure, to reduce glucose and diabetes. It improves them dramatically. And it makes you live longer, actually. So it has been proven that also mixing some degree of strength training, like
lifting weights,
the weights or your own weight or whatever.
A CrossFit, as they call, yeah.
So the really strenuous thing is harmful also.
I was going to say because there are some things I remember. When jogging took off, a lot of people had problems because the heart was suddenly not used to this. A game like squash, for example.
Yeah,
That several people have had
super intensive.
Yeah, exactly. And if you put that strain on the heart and you don't know, that can have very, very serious, if not tragic, consequences.
Yeah, the idea absolutely is to engage in any sport activity, but try to do it gradually.
Yeah.
And listening to your own limits. And of course, if you are going a little bit beyond, it's very advisable to have a basic cardiology checkup, an ECG, and just to make sure everything is all right and that you are on the safe side.
Do people still have a fear? Because we talk about, I remember, I was born in '68. So if you had a heart problem, that was basically fatal. It was, you had to have a major operation, and I remember my father went in for a check about 10 years ago, and he needed a pacemaker, and he was very worried about this, very worried. And they just literally grabbed him, took him in, and he was out the next day and fine. And if he'd thought about it, he would have gone back to, you're going to have heart surgery, and we think it's this huge. Do you think people still think that, and that's why people have a little bit of fear about this?
It's fully understandable because we are dealing with the heart, and of course, no operation, minimally invasive or big operation, is zero risk. But absolutely, the risk have gone down dramatically, especially with minimally invasive operations. But also, even still, the big operations, when they need to be done, they are still safer than they used to be before, because it is not only the surgeon or the superstar doing the operation, it has a lot of people around it. We have the heart-lung machine specialist. For example, we have specialized nurses, we have a specialized anesthetists, and we have specialized people in intensive care and also in rehab later. So it's a long process that, of course, some operations can be rough, but they are much safer than they used to be, and many are the risk has gone down to less than 1%.
And the quality of life afterwards is going to be pretty much
it can be much better or basically normal. And the life expectancy, we expect it to make it normal as well. Yeah. But of course, after the operation, you also need to keep taking care of yourself.
Sure.
Because we can do a bypass or a stent because you have a blockage. If your lifestyle and your medication and everything doesn't change, you will very likely develop another blockage somewhere else.
That must be another thing that annoys you, because you do the surgery, you do any procedure, and then you say to the patient, "This is your aftercare. Go and see this physio. This is your diet." And then the patient doesn't do that, and they have complications, and et cetera, et cetera.
Yeah, we see it very clearly in what we call peripheral artery disease, which is when the arteries of your legs, for example, get blocked, mainly because of smoking, and maybe we need to do a bypass of the leg to improve the flow. And then we tell the patient, please quit smoking, because you can lose your leg, literally. And they keep smoking. And the bypass closes, and then we need to redo it, and sometimes they lose the leg, actually. So, but as I tell you, it's sometimes it's hard. I understand it, but there are medications now also for quitting smoking. There are, there are new tools that were not there before.
And also, because you mentioned before the operation, because you don't go in and, okay, we'll open up and see what is in there. It doesn't work like that. You were saying you go in through the groin, it's the non-invasive, or it's the way that you can actually,
that is, for example, one of the, for the aortic valve. Yeah. Now, we have a procedure called TAVI that is getting very popular. To change the valve, before we had to open the sternum, stop the heart, remove the valve, and place a new one. Now we can do it through the groin. Yeah. And of course, recovery is going to be much faster. But again, not all anatomies are suitable for that. And again, also, there are we don't know what's going to happen beyond 10 years.
Yeah.
Still, when we know that with a normal prosthesis placed in the standard fashion, we can have patients with a mechanical prosthesis for 2, 3, 4 decades even. So that's why we still need to find a place for each technique and which one is better for each patient. And but of course, the diagnosis is made before we do the actual operation, and we go with the whatever technique is better for that situation. And for that, we use echo, which is non-invasive, or we use CT scan that we can check the coronaries, the coronary arteries, and that is non-invasive also. And we can do a lot of things to have a lot of information, and from there see if we can do it minimally invasive, or we can do it, or we have to do it in another fashion.
So, if people are maybe a little concerned, and maybe a little overweight, don't panic, I think, is the first thing, if they're a little concerned.
Absolutely.
Come and get your ET Ulve, get your MOT, get your personal check. And then presumably look at your diet, stop smoking, moderate your drinking, do some exercise. But always get a medical professional before you do any sort of exercise. Don't suddenly think that you can start, lifting weights or playing squash or whatever.
Yes, it is very advisable to do what we call a stress test that's been going on for years. The treadmill, and you just have it all checked there. A stress test is if you are going into a kind of exercise that is really going to push you, then you should be having some kind of test before. If you're just having a normal exercise, like just walking or something that you're going to do very gradually, maybe you don't need to have a super test. You can just listen to your body and act accordingly and don't cross the line. We also, excuse me, the wearables like the watches and all that are very helpful also, because you can measure what you're doing and also see how your heart rate behaves when you exercise, and if it goes through the roof or if it stays down. Those things, those technologies are also helping us a lot, and everyone.
What's the best thing about your work? Is it seeing a patient come back and knowing that you've helped them and their family and they've got their kids, their grandkids, and they're healthy people? Is that the best? Is that the best part?
Yeah, absolutely. It's you nailed it. It's our greatest satisfaction is especially when you have a case that is especially difficult, that is challenging, that even sometimes it has been signed as no option or no. And then we say, okay, let's do it. And we found this option, and let's see. And the patient recovers and things go well. Then that's our maximum price. And that is what keeps us hooked. Staying, working,
makes all
long hours and studying more. Absolutely. And it can also sometimes be very hard mentally, when things don't go as well. But that can happen as well. But of course, when a patient is going through a heart intervention, it's because there is no other option. I mean, because no intervention has more risk than actually having an intervention.
Yeah, I understand.
So that is the point when we decide, hey, we need to do something, and there is some risk always. Yeah. But it is more risky not to do it.
But in comparison to 20 years ago, 10 years ago, we have made such advances that it is, as you said, it is an advance rather than it was in 1980 or 1990, for example.
Well, it's been going on. It's been a progress of many decades. Actually, everything started in 1928. So it's going to be 100 years ago when the Russian physiologist developed what we call the heart-lung machine. any heart operation would be impossible if you can stop the heart and do the operation and then restart it and have the lung and the heart and the lung function done through a machine. And that started actually like 100 years ago when this crazy guy developed a machine and kept a dog alive.
As Bernie M said, oh, those Russians in Rasputin. If people want to get more information, Pedro, where do they find you? Where can people find more information?
Well, we normally do all the interventions in Vita Sanit in Benalmádena.
Yeah.
But we run consultations in GivMed in Gibraltar, in Cuore Clinic in Soto Grande, in Atlantic Clinic in Marbella. So even though the consultations can be anywhere along the coast, the actual operations need to be in a big hospital that has all the warranties.
And the one in Marbella Atlantic, that's the one in Nueva Andalucía, isn't it? That's right in there.
Yeah, right.
I know it very well. I know it quite well. So therefore, it's right in the Gulf Valley. Dr. Pedro, can I just say, your first time on radio, you're a natural, and we look forward to having you. You were kind of nervous, and it was like, no, it would be a natural. Absolutely superb. This is going to be a regular feature on Selena show. Next time you'll have Selena, so don't worry, all will be well. But Dr. Pedro Aranda, thank you, so fascinating stuff. Thank you so much for your time today.
Well, thank you, and it has been a pleasure speaking to you, and you made it so easy for me. So thank you, and I hope we got a nice message out there.
Absolutely.
Planning to travel abroad for heart surgery? You may not need to. In Vita Sanit International Hospital, expert care is just minutes away. Dr. Aranda and his team deliver cutting-edge, minimally invasive heart surgery, keyhole valve repair and aneurysm treatments for more than 20 years now. Stay close, recover sooner. Second opinions, visit marbellahearthealth.com or WhatsApp 629 674 616. Tune in to Dr. Aranda as he joins Selena Mackenzie on The Health Show last Thursday of every month at 3:25 p.m.